Hi there, I'm Mabel Jong. Thanks for tuning in. You're watching the World Healthcare Congress Interview Zone, and I'm so pleased to have Dr. Charles Saunders here, his CEO of Emerging Business at Aetna. Dr. Saunders, thanks so much for being here.
My pleasure, Mabel.
Well, last time we checked in, the iTriage project had just gotten underway. Why don't you update us on what's happening there?
Certainly, it's going extremely well. We're now more than 9 million downloads, consumers, and consistently in the top 10 healthcare apps in the world, being heavily utilized, more than 1 billion inquiries on symptoms each year, and being downloaded in countries all around the world. So what we're doing is that we're expanding the functionality, though, in the application so that not only can we support the symptom to provider pathway, but we can also enrich it with payer functionality. So, for example, if you as an individual want to identify what health plan or employer you belong to, now you can know whether the provider's in your network. You can determine what it's going to cost you to get care. You can determine what your benefit coverages are. You've got an insurance card that you can show. You have access to your claim history, your personal health care record, and then when you leave, you've got a clinical inbox that results can flow back.
Okay.
You can also book an appointment directly, which we were doing before, but now we actually have a broader reach of appointments that can be directly booked with a punch of a button.
So convenience and really information all in one place has really made it a big hit.
Yeah, and it's also a comprehensive navigation experience through the healthcare system, touching more and more components of it in a very simple and compelling way, because that's really what people want. They want convenience, simplicity, they just want it to work, and that's what it's all about.
And when we see more exchanges coming online in October, have any thoughts on whether it is all going to work? Will people find the experience as smooth as what they found with iTriage?
Well, I can't comment on other people's exchanges, and my expectation is that there'll be a certain amount of trial and error that goes on in the United States with these kinds of things. But I think the good news is that the tracks are being laid down for 21st century medicine, and it's going to look vastly different in the 21st century than it was in the 20th century. It was parochial and hard to navigate, and it was completely opaque to users, and it was confusing. And now I think that we have the opportunity to make this a much more compelling and satisfying experience for people that is, lower cost and you get better care.
Well, what have you learned from launching iTriage that might be interesting and informative for others?
Oh, well, I'll give you some examples. So they consistently get 4.5 out of 5 stars across more than 45,000 app ratings on the Apple Store. And we go through and we read those apps, and it's not uncommon that we'll have a review that somebody wrote that said, I was having pain in my jaw or something of that nature, and I called my health plan and they told me to see my doctor the next morning. iTriage advised me that this might be a heart attack and that I should call 911 or I should go to the emergency department, which I did, and sure enough, I was having a heart attack. In fact, one gentleman said he actually had a cardiac arrest 20 minutes after arriving in the emergency department and was successfully resuscitated and discharged from the hospital, and he concluded saying, "Thank you, iTriage, you saved my life." We've seen that multiple times. We've seen stroke victims that actually got early treatment as a result of that. What software application have you ever heard of that's actually saving people's lives? I mean, This is a game changer.
It is really
and
cool.
It makes it gratifying for us to be working in a place like this.
Seriously cool. And can you say that it was launched or really conducted with very few hiccups along the way? Or what kind of mistakes did you experience at first and were able to address those immediately?
There really were no significant issues or challenges, and the reason for that was the way that it was designed. It was designed by ER docs who worked in the trenches, serving real patients. And they would put things out there and they'd get instant feedback because of the iterative way that these applications evolve on the iTunes and the Android stores, where you can get very rapid release cycles with these. So if you get some feedback, you correct, you get some feedback, you correct. There was one issue, I think, where we had a performance issue with one release. And it turns out that when we researched it, we found out that there was a problem in a DLL file at Microsoft, and allowed Microsoft actually fix a software bug that they had. And this is very rapid, these iterations. So very unlike the type of waterfall approach to development that large entities have.
Right. What's next for Aetna?
Well,
in your business specifically.
Sure. We've got 3 thrusts of activity, and by the way, the name of our new company we just branded is called Healthogen, which ironically was the parent name for iTriage, and so now it covers all of what we do. There are three important thrusts of what we do. One is enabling providers to flourish under accountable care, engaging consumers to be more interactive and satisfied with their healthcare experience, and creating a population health IT management capability set, so tools for managing a population. So those are the three thrusts. So with our accountable care organizations, that's growing very, very rapidly around that. We've got 20 institutional ACOs that we've done. We have more than 100 patient-centered medical homes, and we should have about 30 ACOs in total by the end of the year. iTriage is going gangbusters. Active Health is another business that we have, which is clinical analytics and care management, and that's growing significantly. I think up like 40% in sales pipeline from the previous year, thanks to the transition in accountable care. And Medicity, our health information exchange, is going rapidly. But we're always constantly inventing new businesses, and we've got about another 6 businesses behind those that deal with social connectedness in care, sort of a social care model, and deals with enabling individual physician practices and IPAs to be successful. And we're starting to get calls from around the world to go into other health systems and see what we can export into those environments so that they can address their population health needs.
Well, clearly Aetna is moving away very quickly from just being an insurer. What is the end game, do you think, would be for Aetna or companies like Aetna?
Oh, we joke about it. When everybody is well and healthy and nobody is sick, our job is done. So, I think that we will one day be the leader in accountable care. I would say arguably we are right now. That we will be providing a high value service to our members and our employers' members that is the triple aim. It's affordable, accessible, and high in quality, and it's very satisfying. And we'll be doing that through a complete rethinking of the networks that are provided to employers that are value-based. And we'll provide a rich and rewarding consumer experience, multidimensional, web, mobile, social, so that they experience healthcare differently. And it will fundamentally bring down the cost of care versus the trend in healthcare in the U.S. And it will be a different company, a very diversified company with a rich array of services and technology and tools, but with its core business in understanding and managing risk on behalf of purchasers of care, which they've been doing for 160 years.
Right. Why change something that's going well?
That's right.
All right. Thank you so much.
It's my pleasure, Mabel. Thank you.
Pleasure. I'm Mabel Zhang. Thank you so much for watching.